Thank you for joining me. Welcome to this presentation on a population at risk, including those with anxiety disorders. My name is Jessica Copley. I'm an LP and a BSN student at Indiana State University. The objectives include to understand the difference between types of anxiety, understand who is affected by anxiety, be able to recognize risk factors of anxiety, be able to recognize symptoms in ourselves and others with anxiety, understand types of treatment plans and which work best, be able to implement practices to reduce anxiety, and know where to go for help. At this time, please pause this presentation, go ahead and take a look at the outline, and take the pretest, and continue when you're ready. Description of anxiety disorder is that anxiety is considered a group of conditions that cause feelings of anxiety. This is a most undiagnosed mental disorder with a recorded amount of 16% of the American population. Generalized anxiety disorder is a chronic and unrealistic worry and tension about life circumstances which last 6 months or more. It oftentimes begins in childhood or adolescence. It is more common in women than men. Symptoms include trembling, twitching, muscle tension, headaches, irritability, sweating, or hot flashes, difficulty breathing, and nausea. Panic disorders is a period of intense fear that is abrupt and unexpected. The individual feels like they're going to die, go crazy, or do something uncontrolled. They're diagnosed when they become frequent or regular. And as it increases in frequency, the fear also starts to cause panic attacks. It may result in phobias and isolation, and also can increase depression up to 65%. 6 million American adults suffer from panic disorder. It is most commonly in the ages of 17 to 30 years old. Symptoms include difficulty breathing, dizziness, chest pain, nausea, numbness, trembling, sweating, and choking. Treatment includes medication in the form of benzodiazepines. Phobias is the irrational fear of something, and facing that fear can cause extreme anxiety and embarrassment. Most common phobia is public speaking. Those affected by phobias include 8% of the American population. It increases if there's a family history, if the individual has depression or anxiety. Treatment includes cognitive behavioral therapy and medication. Also, desensitizing the individual slowly and systematically with those simple phobias such as spiders, heights, or small spaces can help reduce the effects of the phobias on the individual. There's also obsessive compulsive disorder, which is anxious thoughts and uncontrollable rituals. These obsessions assist and keep away anxiety and negative thoughts and cannot be ignored. The compulsions are the behaviors that are repeated to rid themselves of that obsession. It affects 2% of the patient population, most commonly appearing in the teen years. Oftentimes, it goes alongside the depression and anxiety. Commonly, these compulsions include hand washing, counting, checking multiple times, or touching. Treatment includes behavioral therapy and medication. Another anxiety disorder is post-traumatic stress disorder. It's recurring, persistent, frightening thoughts about memories that become debilitating. Oftentimes, the individual will relive the trauma on repeat with nightmares, recollections, or flashbacks. Common causes include those that were in war, so veterans is the most common, those that experience violent attacks or a horrific accident, loss and natural disaster. Those who witness a traumatic event are also affected by PTSD. Causes include sleep disturbances, depression, becoming emotionally numb, and avoidance. This goes alongside depression, anxiety, and drug abuse. Treatment includes antidepressants, psychotherapy, and family support. Recovery can take 6 months or become a chronic problem. Screening can include answering these questions. If you know of a loved one who's experiencing anxiety, or you yourself, but also for those in the medical fields. If you answer yes to any of these questions, you can continue another screening based on that individual anxiety disorder, such as generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, social anxiety disorder, or having specific phobias. If you answered any of those, please take a test and speak up and talk to a medical professional. Common coping strategies that help one with anxiety includes yoga and meditation, eating a well-balanced diet, limiting caffeine and alcohol, sleeping well, including up to 8 to 10 hours of sleep, counting to 10 and taking deep breaths, understanding and learning about your triggers, working towards positivity, and including exercise in your weekly activities to help reduce anxiety. There are many resources that you can seek to get a little bit more information about different types of anxiety, also tips to work through your anxiety, who you can talk to, links are available. But please, if you're experiencing anxiety, reach out and seek help. At this time, please take the post test. Thank you so much for joining me.